presenting. Okay, sure. Okay. That's the wrong thing up there. Disease neurological presentation. Cognitive impairment is serious. We know that different things will help you perform better cognitively, and certain things will, of course, take your cognitive abilities down. Of course, number one is sleep, number two is nutrition, and number three would be hyperstimulation. But COVID may impact individuals across all various age groups with a cognitive issue. It's pretty devastating for young people, especially those who are in the best health, until they get COVID. Some improve, most of them improve right away, but some lapse into what we call this brain fog. One of our people that used to attend these presentations was a therapist, and she came to me with terrible brain fog. She actually had to quit her therapy job because she just couldn't focus and attend anymore. So this is one thing that we found. One study has shown more than 80% of COVID patients encounter some sort of neurological conditions, complications. So researchers think that these cognitive effects are a byproduct of the inflammatory process. So we know there's a lot of things that can cause neuroinflammation in the brain. And of this list, that you can have extremes of heat, cold, or pain. People in chronic pain the brains will be inflamed. People who have been exposed to psychological traumas can go through the same process. I think about the kids out there right now who have been basically the last year and a half of their life have been totally turned up on their ears. And Miss Emma is with me today, and she's was telling me she's only attended 4 classes in person since she started her grad program over a year ago. So it has really affected how children, young adults interact with their peers. That has caused a lot of things. But I think that this can be leading to this neuroinflammatory process. Neuroinflammation occurs when a virus or bacteria penetrates the blood-brain barrier. So that's why some people get brain fog and some people don't. It depends. It depends on a lot of things, but we're looking now that maybe 80% get some sort of neurological, contract some sort of neurological problem. With COVID-19, there's an activation of the immune system, and this activation of the immune system, this neuroinflammatory process, can go on for months. We don't know how long it will go on right now because we're still in the first year and a half of the pandemic. So I think this is up for discussion. And we understand that long-term neuroinflammation can cause, these issues to last probably for a lot longer than that, because after the COVID has come and gone, the aftermath, the trauma that we're going through in this country is just tremendous. So the symptoms, there is no diagnostic test at this time for neuroinflammation or brain fog. The condition isn't visible on any imaging exams. Instead, the patient and doctors rely on the following symptoms to determine whether the patient is suffering from post-COVID cognitive impairment. PCCI. That's a good acronym, PCCI. Headaches, dizziness, fatigue, decreased attention, memory loss, poor executive function, and I came across this the other day, vivid dreams. Hadn't heard about that, but I have heard of those reports here recently that we have these vivid dreams, not necessarily nightmares, but I guess they could be. In rare and severe cases, patients may develop post-COVID-19 psychosis, ranging from hallucinations to paranoia and severe mood disorders. When we're looking at COVID infection into the brain, it can produce a focal slowing from some sort of trapped whatever that gets into a part of the brain, creates a focal slow part. We can see it create seizures. The seizures probably created from COVID are because they're in part of the brain that hits the insular cortex and causes the psychosis and hallucinations. Now, in psychosis, we have to know that there's also delusions can be psychotic. Okay, so delusional thinking is something you really got to be looking for, because I think we'll see more of that than we will from the actual visual or auditory hallucination. In rare severe cases, this psychosis can go on, we expect can go on until we do something to correct the problem. Symptoms. Some may also have more specific thinking and behavioral issues. They forget names of people who they know well, and us that belong to this senior citizens out there, we're already forgetting names. And to how can we judge? Is it worse than it was before or not? This is something I think we've got to be very cognizant of. It can be a part of the normal aging process, or it can be COVID. If you're in your early 20s, you probably shouldn't be forgetting names. They can't follow along during a business conversation. Again, you lose track of where you are because your brain is spreading out and doing something else other than it should be. Prioritizing and planning is suddenly difficult. Okay, it has to be a change. How were you before COVID? How are you after COVID? Now, I think that's where we have to make a comparison. And anxiety and sleep. These are the two things that we always see with any sort of inflammatory process. What should you do? Now, this is where we come down to, if there are no established treatment for COVID-19 cognitive side effects. There are things that we're going to talk about here in just a little bit when Ms. Brigitte comes on, but there's nothing right now out there in the industry, but there are several things being tested. Some clinicians are treating patients with low-dose stimulants because, again, trying to make them a little bit less ADHD. Pam, I think you're going to see a big upswing in ADHD following COVID, especially in your young adult and adult populations. Not that it's true ADHD, but it can be classified as ADHD because it meets the symptoms criteria. Others suggest awakening the senses by introducing strong smells. I haven't heard of that one until I was doing the research for this presentation. That's interesting. I know that sometimes they use bee stings to try to help people make nerves where there were no more nerves. So I guess strong smells may be one of the things that they're looking at. So this is kind of an interesting approach. And still others are experimenting with behavioral strategies such as meditation, exercise, and support groups, psychological counseling. No matter what you get, those things should help regardless. So meditation, exercise, right on the top of the list. Support groups definitely need to be with people. And psychological counseling, we all could use that from time to time. What should you do? Well, number one, you got to see a primary care physician to rule out other causes. There are other things that can cause transient cognitive impairment besides COVID brain, other than COVID. Issues with metabolism can contribute to this. Hypoglycemia, if you all of a sudden you develop diabetes too, could actually underlie some of these same issues. There's many, many things that could be the cause of it. So we don't want to automatically leap, and just because you're having these issues, if you had a recent brain injury, oh my gosh, yes, that can cause that. You don't have to be knocked out to have a substantial bang to your head and have issues with brain injury symptoms. Once your immune system returns to the baseline and the immune cavalry recedes, your brain will recover. That's the statement out there right now. I don't know if we would recover, because I think we're all in a state of chronic stress. And even after we get through and our brains do heal, the aftermath of what we've been through for the last few months is going to create a psychological battle within us that's going to continue this process. In the meantime, you can support healthy brain function by eating well, of course, getting regular exercise, yes, spending time outdoors, yes, and of course, sleeping well, and gradually resuming your activities. Just spending time outdoors, guys, I think this is a key component to it. For millions of years, as a species that was developed over time, we were primarily outside creatures. It's not till the last 200 years that our species crawled inside and we see very little sunshine most of it during the day. I really think this is where it is, and this leads us into possibly a treatment for COVID brain. What are we doing? We're assessing brain function with EEG and QEEG studies. We want to actually look at, when people come in, we want to take a look at their brain And we think we found and identified, and we're doing a study on that, a neurobiomarker for COVID brain. Right now, if you're looking for a biomarker for neuroinflammation, it's very secondary in that they have to do a spinal tap to get a positive identification of neuroinflammation. Spinal taps are not fun to go through, and EEG is much easier. We're using these tests to test this hypothesis we have that spindling excessive beta, one of our biomarkers, is a neurobiomarker for neuroinflammation. It seems to hold quite true. We've got a study going right now, another study about people who failed multiple attempts at medication. There's 1,233 people in this study, children, adolescents, and adults, pretty equally distributed. And we've identified that the spindling excessive beta is in 22% of children, 20% of adolescents, but 31% of adults. So if you think about adults, they've got more exposure to more things. So if this would really ring true that we would expect it to be higher in the adult population because they've lived longer. So let's turn this over to Miss Bridget, and I'll let her take it from here. And the floor is yours.
All right, so I'm going to be talking about photobiomodulation. Photobiomodulation, we use the Vielight device for this. What this does is it goes in and it emits a near-infrared light at about 810 nanometers. And what that does is it stimulates our mitochondria to produce nitrous oxide. What that does is it helps dilate our blood vessels. It improves our circulation, therefore helping with toxin removal and inflammation reduction. So what are the side effects of this treatment? Okay, some side effects are improved sleep, some excess alertness. We do like to do a QEEG before treatment, just so we know that their brain is ready for this type of treatment or is in deficit of the stimulation that we're giving them, because we want them to be receiving the best kind of treatment that they can be. We are just now starting to use this device on children. However, we do have to start them off very slow. They can, there has been reported incidents of headaches in children that I've used it. So we like to start them off slow instead of at the set 20 minutes. Now there's two different types of Vielight. So I did mention there is stimulation. There's two types of stimulation. So along with those beneficial effects of inflammation reduction and toxin removal that are available in just the Vielight regular photobiomodulation device, they have stimulation devices as well. The Vielight Alpha stimulates at about 10 hertz. You qualify for the Vielight Alpha if you show deficit in your slow alpha waves on your QEEG brain maps. This is commonly seen in individuals who are suffering from PTSD, anxiety, severe depression, and sometimes head injuries. If this individual is reporting symptoms of inability to self-soothe, which alpha does seem to help with, and then we do a QEEG and on their brain map they have excess in 10 hertz, we do not want to give them the Vielight Alpha. The reason why is naturally when we do a QEEG on someone and they're having symptoms of psychosis or delusions or hallucinations, they usually tend to produce excess in this lower brainwave alpha stimulation. So we do not want to give them more of that alpha frequency. We would rather find a different treatment for them that would still help with their symptoms, improving those same symptoms. What does alpha do? So alpha is prominent when we are calm and in meditative states. This is kind of the idle or resting state of the brain. And alpha helps with our development of mental coordination, self-regulation, and our inner peace. The next device is our Vielight Gamma. This oscillates at about 40 hertz, so it's a lot faster. To qualify for using the Vielight Gamma, you need to be diagnosed with Alzheimer's or Parkinson's disease before, or do acute EEG and show focal slowing. Now, the reason why I can say that anyone who has been diagnosed with Parkinson's or Alzheimer's can use this is because we know beforehand that they're probably going to show focal slowing on their QEEG, especially if they've already been diagnosed with the disease. This is really awesome for anyone that you know personally, whether it's your brother or sister, your grandparents, your parents that may be suffering from this disease. This is something that they can use daily in the morning to help with their memory and cognitive impairment. So what does gamma do? Gamma is prominent when we are attentive or in the process of learning. This is an active state of cognition in our brain, and it can lead to an increased mental acuity. So you have less word finding issues. It's very important to note that gamma should be done in the morning. Why? This is a stimulation device. People respond differently to stimulation, but on the spectrum, there are people that are very sensitive. This lasts for about 10 hours. Think about it like a cup of coffee. You do not want to drink a cup of coffee right before you go to bed, or you'll be up all night. So it's very important to do the Vielight Gamma when you wake up in the morning. That way you're getting that burst of energy at the beginning of the day and not right before you're about to go to bed. Now, right now, since we were talking about brain fog, I'm going to go ahead and wrap that around to our COVID clinical study that's going on right now. This is being done by the Vielight company, and you are welcome to go and check it out. It is on their website. Unfortunately, they have not announced which Vielight mechanism of stimulation they are using. They said they're using their new Vielight RX Plus, but unfortunately, they do not have a set stimulation on the RX Plus. So I'm not sure whether the alpha or gamma will help. I do know that the photobiomodulation does help with toxin removal and any inflammation reduction. So even just buying their simple photobiomodulation device that just shoots the near infrared light, I believe it's just a nose piece, will be beneficial if you suffer from brain fog. We also have Emma over here. She is wearing our Vielight device right now, just for anyone who is wondering what that looks like. It's very easy to walk around and wear. You can wear it in the morning or in the afternoon when you're watching TV. It has about 4 different lights on it. This one's in the front, and the other 3 are in the back. And then right here, this is our most invasive part of our procedure here. It is our intranasal stimulation device. Now this is the most important part because it goes in and it stimulates our subcortical structures. All right, that's all I have.
Okay, guys, Miss Emma's back from University of Texas, Tyler, in a clinical psychology neuroscience slanted program, and I think that we're fortunate to have her here as a model today. So I said, let me just hook you up to this. Bridget didn't know we were going to do this, either did I, but I think it's something that's quite interesting. You got to see it. You can finish out the session, Miss Emma. You don't have to worry about taking off till it beeps. It will beep on its own. It's 20 minutes. Now, what we've done here is, this is a piece of equipment with a discount code. You can get it for like $1,400. It's normally about $2,000 for the one, the alpha that. But I don't think people should invest that kind of money until you try it, see if it works. So if you've got this stuff, we charge $50 a session. Come by and do a 20-minute session with us 2 or 3 times. Give it a shot. If it seems like it's working, then you can buy your own. That puts us out of it. And I think that's just a good way to treat people. We want to track these people over time because we want to look at our impact on brain fog. And so that's why this whole purpose about, I tested it. I think that it's on myself. I don't do anything to anybody that I haven't gone through myself. I think it's got very positive implications for many more things than brain fog. But this is a way that we can address and help people, and not necessarily, how many people got time, have the time to come in multiple times a week. But if you get your own unit for, now that it's been recommended by the FDA approved medical equipment, and it's got the indications for Parkinson's and Alzheimer's, separate from the brain fog deal. So that's something, but for our seniors that, as I'm getting there myself, that we know that a lot of people getting to be our age are having issues with forgetting, as we just described earlier. So this may be something we'd want to do. So at this time, it's about 38 after. I want to open up for questions. Do we have any questions out there? You can go ahead and open your mics.